Welcome back to the Chief Healthcare Officer podcast. Today's episode is not just about technology, it is about physicians, it is about us, their practice, their well being, their sense of agency, and the responsibility we hold as healthcare leaders to create systems that support but not exhaust the people at the heart of the care delivery. We often speak about the patient centered care, digital transformation, or operational excellence, yet we sometimes overlook at the foundational truth. When physicians are disconnected, unsupported, or unheard, the entire healthcare system becomes fragile. And we have experienced this in so many occasions. My guests today, Dr. Graham and Jake, and they are the co founders of Offcall, not on call, off call. And that's what I was just discussing with Dr. Graham. I mean, today I had so many meetings and on call management was part of it. So we are discussing off call. What truly stood out to me is not only what they have built, but what they have built it and why they have built it. That's what we're going to discuss. And Dr. Graham recently wrote a founder letter that reflects deeply on physicians, the realities of the modern medical practice all around the world, and the need to restore clarity, autonomy, and well being. So we can discuss more and more on this introduction. But Dr. Graham, Jake, welcome to the show. It's a pleasure to have you here.
Thanks so much. It's great to be here. I like it's exciting to be on the other side of the podcast interview microphone this time.
Agreed. And thank you for having us.
No, my pleasure. I listened to your podcast as well, and the way how you have been, I mean, discussing the things how you have created and the other things. So I'm sure this time we would just want to hear from both of you, and then we just want our physicians and nurses and other people to hear what exactly this story is about and how we can sort things. Because when I look at my hospital in different kind of worlds, and then in the region, not just in the Middle East and London and other areas, I think you guys are addressing a global problem about the physician burnout and physician difficulties for the operation. But I want to start with you, Dr. Graham. In your founder letter, and I read it, I really enjoyed as a physician. You speak very openly about the physician work and then the daily practices, but not as a tech founder. You're talking about the pressure, the fatigue, and loss of control in modern medical practice. What was the moment you realized that physicians needed something fundamentally different, but not just another digital tool?
Yeah, it's a great question. I for a long time watch how physicians talk about their lives on social media and talk with my colleagues and friends, and I'm on text threads with friends as well. And I think certainly kind of coming out, particularly after COVID, I think that there was quite a significant shift in how physicians were feeling about their work. In the United States, at least, many of us are employees of someone else. Often that organization is not a physician or a physician-led organization. And, I was seeing physicians not really know if their if their contracts were even fair, right? I don't think physicians go into medicine as a get rich quick scheme. There are way better ways to, you know, become wealthy than working nights and weekends and holidays and missing your kids' birthdays and not sleeping well and all of these things. And so I really was getting the sense that physicians were unable to really represent themselves, both from kind of a financial negotiation perspective, but really, I think more importantly, around physician autonomy, control, resources to support their kind of well-being and their practice of medicine. My idea, my vision was never that Offcall was going to like double physician salaries at all. My hope was there was an increased recognition of what the challenges are of practicing medicine today. And so that, maybe physicians had more support, more resources, more a medical assistant, reduced paperwork and things that make the work not enjoyable. I think most physicians love practicing medicine and are extremely dedicated to their patients and go above and beyond. I mean, doctors are spending hours a night often doing paperwork and writing notes. I don't think human beings would do that unless they thought it was important, unless they had truly a dedication to this as a profession. Um, but I had guests on my own podcast. I think it's pretty clear that the that level of dedication and responsibility and ownership has unfortunately been abused by some health systems and some insurers and some other groups of people. And I thought we needed to address that and try to change it.
I totally agree. I mean, at the time of COVID, the important thing what we have noticed, the health awareness has increased a lot, and then this also made people more aware of their health issues, and we started seeing even more patients looking for the healthcare services. Then this increased the demand, but at the same time, we cannot increase the number of physicians in the same way, and those physicians who have been already under huge load started having even more and more load. And definitely, I mean, we need to have some solution in between. But here, I want to ask one question to Jake. The uh, the human touch is very important, and doctors they're already suffering with too many digital tools and the others. I mean, in my book in Connected Care. I wrote over there so many chapters, but the first chapter I wrote was about having this self connection and understanding yourself first as caregiver and taking care of yourself before taking care of others. So, how did this philosophy translate into the what Ofcall is offering today?
Y- At Offcall, we are taking the big bet that building for and by physicians and really focusing on clinicians' core needs, you can build something really meaningful and really special in the long term. And this really shouldn't be a controversial statement. I mean, it really shouldn't. But unfortunately, what we see in the US and globally is that most people in health tech and healthcare build for health systems, they build for payers, they build for other key stakeholders. But when it comes to clinicians, they're usually the second, if not the last thought. And so the way it usually comes about is we're going to build a piece of technology and we're going to push it onto the clinicians and force clinicians to use it, whether or not that's actually good for their workflow, whether that's good for their life, whether that's good for their well-being. So we've taken a completely different bet, and I'm so proud and excited to be working with Graham because this is something that Graham has done multiple times now over the course of his career. Through MD Calc, which was his first company, through Offcall, we are trying to build around the groundswell of what physicians and what clinicians actually say they need and say they want, and service those needs with really, really, really great tools and a really great community. And as far as your question about how we address it and how we're thinking about it, it really infuses and is a core part of everything that we do. Our product team is built to listen to physicians every single week, go into clinics, go into health systems, shadow workflows, understand what exactly physicians are upset about and what would help restore autonomy and help address burnout and help bring more financial wellness and well-being to this group of people. And I think the approach is starting to resonate. It's very early days and we're only about a year into it, but we're already hearing from our colleagues in Canada and in Europe and in the Middle East and different places around the world saying, when are we going to bring off call to our market? Because we need the similar approach and we need similar tools. And what you're saying really resonates with us. And that's why we're excited to be talking to you as well, because that's the work that you do. But I think at the core, the way we have set up the company and the way that we've structured who we're building for and how we're thinking about the business in the long term is if we build for clinicians and if physicians win out in the long term and we can build trust and build tools that actually solve problems, we're going to win out in the long term. And so that's exactly the approach that we take.
I'll just shout out Jake. Jake is probably, I'm not exaggerating, has probably interviewed and spoken with hundreds of physicians. I think at this point, like when Jake and I first met, I think he'd already interviewed maybe over 100, and now it's probably, 200 or 300 physicians he's talked to truly try to understand like what is actually going on, what is actually the problem, and same with our design team. Like our design team has like shadowed, and Jake as well has shadowed in doctors' offices to fundamentally understand, okay, what do you actually do? What is the actual workflow, and how can we insert ourselves to help simplify this, improve it, take away the paperwork, take away the pain? And yeah, I think that's the approach. Building for physicians, as the physician, as the, I guess, customer is the best word, the user certainly, um, is critical. At least in the United States, there are a lot of things that like the physician has to do, and that's maybe it's for regulatory reasons or billing reasons or med legal reasons. But, fundamentally, the consequence, the outcome of that is it all gets driven onto the physician's shoulders. The physician has to sign something. Only the physician can fill out the 9-page form, and that fundamentally just, takes away from what the physician is trying to do, which is deliver care, what the patient wants, which is deliver care. There's this kind of unspoken chunk of work that gets, hoisted onto physicians, and it's not what um, any human in the system wants. It's what the system wants.
Dr. Graham, I really appreciate that. But I mean, the more I listen to you guys, and I'm sure the more these listeners for this episode listening us, now they started thinking as if you guys are offering a magic solution. There's a mystery. So
We have magic
I think
seas, we have magic wands, we have spells. And we're gonna
I
fix
can
it all.
see.
It's gonna be so
I
easy.
can see that. So they will think that, oh, they have created maybe AI scriber, or they have vanished the insurance guys. So I think it is better this time if you just explain us what the off call is. Then let's continue with the invisible load and then the others. So in couple words, just please tell us what the off call is.
Thank you. Great question. So we started with a transparency tool for any employed physician in the US to be able to access real time, up to date, and accurate data about whether their current job and whether their current contract, if they're applying for a new job, is fair. And so on things like salary, on things like hours worked, on patients seen, on call, on all the different metrics and aspects of what makes a job a good job or a bad job, or you're feeling exploited or abused in a job. Physicians can now go to Offcall today, enter their information anonymously, and access thousands and thousands and thousands of real-time accurate data points in their specialty to benchmark and compare themselves to their colleagues. And so that is something that we feel very strongly about. It's a core part of Offcall, and we've seen that has been able to help. Honestly, we get dozens of messages every week. It's been able to help dozens of physicians who are either thinking about applying for a new job or negotiating their contract currently, or they're currently in a job and they feel trapped in that job and they're trying to understand if this is actually normal, the hours worked and the patient load and compared to their colleagues. They're able to now get that information for free, not paid, not data that serves the hospital, not data that serves their employer, but data that actually serves them. So that's the core of Offcall today. We are also thinking about the future and where is the puck going kind of 5 to 10 years from now, and how is this profession going to continue to evolve. And our product team and our engineering team are working on some very, very exciting pilot tools for groups of clinicians, both in health systems and independent physicians, where, 5 to 10 years from now, if the current status quo persists, we're starting to see there's an interest and a swing back to going independent. And there's new models that are available for doctors who want to go independent. And we're thinking about, okay, if that happens and the current status quo breaks and physicians just have decided we've had enough and this bargain is not worth it because of how we're getting exploited and feeling a lack of autonomy, how can we support those clinicians and those physicians who decide they want to go back into independence and they need a set of tools in order to help them do that? So we're thinking about both today and the future and helping doctors, and also, as Graham said, listening to doctors every day and every week and trying to think, okay, 5 to 10 years from now, what is the toolkit for that physician going to look like and how can we help serve it?
That's a wonderful service. I'm sure the health systems are not happy with you guys, but then doctors will be definitely happy because you're making them aware of the reality. So then it is not today's problem. It will be a problem forever, I believe, because of the whole pricing, transparency, and the other issues that we have been discussing. Definitely, I mean, helping them to understand how the business works will not just make them aware, will also help them to identify their priorities in the workspace. Because the other problem, what we see, sometimes maybe you have an amazing package in your hand and you keep thinking that, oh, it could have been better. And then you're not giving yourself to your patients or hospital while making your mind busy with such things. At least with your, guidance, these doctors, they will see that, look, you know what? It seems I have something good in my hand, so then I can focus on my patients and I can take it through. So we have so many things, and I believe it's a global issue because doctors, I hire doctors right and left, and I kept telling them, guys, please read the contract before you sign. No, I mean, in the medical school, no one has taught us about it, and we simply receive the contract. We're all excited, we sign it, and then we just understand when we get into the work and when we understand the work hours and then the other thing, and it's already very late. So, Dr. Graham, let's just get into more the daily work issues. Then later on, we will come up the part how Ofcall could help doctors better. So let's understand the problems, the constraints better before we go to the next part. Um, you wrote also in your founder letter saying that doctors have an invisible load, the emotional, cognitive, moral, and then so many other things. And you keep discussing with the doctors. Jake meets with them. You're already, practicing physician. So, which one is the biggest actually problem today in physicians' life when we look at all these constraints?
Yeah. I think the thing that feels probably most pressing to physicians is the lack of autonomy, agency, control. In that, I think physicians truly feel a responsibility to deliver the best healthcare possible, but then they're not like given the autonomy and tools and power you know, to control to help their patients in the way they think is maybe best. You could imagine um, giving every patient a 15-minute appointment um, might have made sense 20 years ago when patients were maybe healthier, they had fewer medical problems, they were on fewer medicines, and maybe it's still completely appropriate for a 22-year-old with a urinary tract infection or pharyngitis. A reasonable physician can manage that in 15 minutes. Um, but the system says that's the requirement for all visits, or the insurance company says, yeah, we won't pay for a longer visit. This is what you get. And so I think the challenge there is you have a 95-year-old who is just discharged from the hospital and has 20 active medical problems and is on 15 medicines, um, and has 7 chief complaints. The idea that the physician is still supposed to make that all work in 15 minutes is laughable to every physician that has ever seen a complex patient. And so I think that the feeling is that physicians are getting squeezed from every angle. Patients view us as in control, that we control everything, that how things work in the United States. Many times the insurance is really deciding if the insurance will pay for a CT scan or a medicine. So the patients have these expectations on us. The health system wants us to do things in a certain way. The insurer won't pay for certain things, and so I think the feeling is to many physicians that we're just like squeezed and pressured from every angle. Yet we have the expectation and the responsibility to deliver really good healthcare to an individual. And so the system wants, simplification and economies of scale. The patient wants individualized care, which is completely appropriate. Doctors are trained to deliver individualized care, um, but also trained to be able to like prescribe medicines and get tests done to advocate for their patients. But the payers want to have us jump through hoops. So I think it feels like we're getting pressured from every angle, and it's like we're not turning into a diamond, we're turning into coal, I guess maybe is the analogy.
And I believe this is a global problem. I mean, when I look at my hospitals, let's just figure it out. Just to visualize, I'm a physician. I'm already seeing my patient who is just looking at my eyes. And at the same time, someone is knocking the door from the follow up, and the person just wants to ask for the lab results. And then I have another walk in patient in between who has been waiting for 2 hours in the waiting area for me just to see him or her in between my booked patients, and my management asks me to see more and more patients to make my clinic feasible, and in between I may need to go to the ER just to help the Dr. Graham because he's asking for a consultancy, so then I have to rush over there and here. So definitely, I mean, when we look at from this angle and no one sees this, it is a very difficult job. But then let's move to the other side.
Can I just
Today,
add can I
when
just add
we
one thing to what you
Sure,
said
go
real
ahead,
fast? Uh,
please.
um, I just think this is so important to call out. All of those goals that you just mentioned, they're all good goals. Like controlling the cost of healthcare is a fine goal. Trying to provide standardized care is a fine goal. Trying to provide individualized care, or trying to provide emergency care, or add in that walk-in patient. Those are all things that we would all probably agree. Yeah, the system should support that. It's just I think it's really just exposing all of the challenges of trying to have each of those values and goals all be equally important. Like you fundamentally run into competing pressures, just like you illustrated so perfectly.
I mean, we have been trained for this in the medical school. All what we want to do, we want to help our patients and we want to please them. We want to help them. They need our help. But in between, sometimes we're forgetting ourselves and then trying to find a way to go through. But Jake, the point when we today look at the job posts, um, they don't even most of the time share the compensation details. They try to share a little bit things here and there just to pull you in. And then the contracts are quite complex for the doctors to understand unless you have lawyer or someone helping you. So from your perspective, how does restoring this kind of transparency and voice impact the physician well-being? How do you see off-call helping to these kind of poor people?
Yeah, I mean, I think the eye-opening thing that Graham and I have learned since founding Offcall is, at least in the US market, if you took a group of 1,000 physicians working for different hospitals, there would be 1,000 different contracts. And there is no standardization when it comes to um, contracts and the job. And in other industries, in the technology industry, in other industries in the US, you do have a sense of benchmarks and you have a sense of laddering. And of course, there's variability job to job, but you have a general picture and a sense of, given your experience and given the job and given the band and given the number of hours worked, this is what I should expect to see. That just doesn't exist. And so what we see is unrest in the workplace. And from a physician standpoint, you're getting squeezed every which way that Graham just talked about. And you're coming home and completely burnt out, and then you're asking yourself, is this normal? Is this fair? Is this a job that I can feel confident that despite all of this pressure that I'm facing, that this is abnormal and this is just a hospital problem or an employer problem, or is this standard and fair? And what are my colleagues seeing for the same thing? And so I think from a leadership perspective and a health system perspective, this is a funky thing where it's actually a win-win. More transparency is actually good for hospitals and is good for the workplace. Because when it comes to the hospitals, the last thing you want is you want your physician workplace that is very expensive to hire and very expensive to retain to go and look for what other options are out there, change jobs more quickly, go see what your colleagues are making, and then go demand and either leave the job or demand for more. You want more transparency because you want a physician who's engaged and satisfied and excited about their role. And even if there's a lot of work, and even if there's going to be strain, you want a physician who understands very deeply where they're being compensated today and what the opportunities are in the future. So that's definitely one piece of it. The other piece I just want to say is, we've been fortunate and privileged, as Graham said, to hear from and talk to so many physician leaders. And one consistent theme that we hear over and over and over again is that when it comes to burnout and it comes to wellness, the typical playbook from the employer is to throw a pizza party and give out a few gift cards at the end of the year and have a holiday party where you get to go to a baseball game and act as though, or have do a yoga session and bring in a yoga instructor, act as though those things, which are very, very surface level in many ways, are the solution to burnout. And I think that actually drives physicians crazy because it's not a real acknowledgement of the core issues, the core structural issues. And it's not a real acknowledgement of what physicians really want, which is more transparency about their job and a voice at the table and to know that their voice matters and to be listened to in key conversations when it comes to the direction of the hospital. So I think, a year into this now, what we've learned is transparency is everything. And when it comes to, how it could actually help physicians restore burnout, physicians are not looking for more pizza parties and gift cards. Like that is not the way you're going to get them really excited. Being transparent and knowing that you're being fairly compensated for this job, understanding that today and understanding your growth trajectory at the employer in the future and having a seat at the table to make real leadership decisions is exactly what the physicians are looking for. And that's what everybody should want. It's a win-win if the physician workforce is excited.
I think we may have more information than some of the health systems and hospitals have that's maybe even more honest. I think there are some physicians that are kind of maybe a little paranoid or a little worried that if they're honest in their wellness survey or their net promoter score survey for their internal employees, that'll get back to the leadership and that they'll get penalized. And so I think it's possible that we actually have more accurate data on how burned out physicians in hospitals truly are. And the physicians might be a little bit more honest on off call on a platform that they know is built to try to help physicians than they are with their own internal kind of employee metrics. And tools. And like Jake said, it's really expensive to have a physician leave a hospital or a health system practice. It probably takes at least a year to get the physician fully onboarded into like kind of the way to navigate the system and handle everything. So I do agree with Jake. I think it is the transparency is a win. I've talked to like chief people officers of physician groups who want this information as well. They've literally said to me, we don't really know what, say, a young millennial or Gen Z physician actually wants, what their priorities are, and so they want to be able to offer the most competitive package possible, but they don't really know well what a new fellowship trained, residency trained candidates, new attendings want. Do they want more vacation time? Do they Are they more focused on retirement, or are they more focused on vacation time? I think younger physicians, I've seen trends that people want more vacation time, and they're less excited by retirement, 401k plans, because they may not be at that job for their life in the way that, like, my dad's a physician. My dad practiced at the same hospital my entire life. The I mean, literally, I've been alive 45 years. He just retired last year. He practiced at St. Luke's Medical Center, system in Kansas City, Missouri, for, I don't know, 45, 50 years. And today's physicians have no
Well, the
expectation that they will
baby
work at the same
boomers, they
place.
were different. I mean, we are
Yes, it's
definitely
a
different.
totally
I mean,
different. Yeah,
at at
yeah,
this
yeah.
age, we want more transparency. Maybe your father didn't even have a contract. I mean, he just signed an offer letter. He just started.
It's
Who
entirely
knows?
possible. Yeah, yeah,
Yes, I mean, we
yeah.
don't
Just,
know
hey,
things.
Dr. Walker's just going to come
That's
see
fine.
patients. Yeah, yeah.
That's it. That's it. So, but then, I mean, now I'm listening you guys as a physician leader who is also hiring close to 1,000 physicians today, and I will cancel all the pizza parties. No worries. I mean, we will bring something else later. But then, teach me. I mean, is it just about transparency? Let's make it very transparent. And I will also tell you one other thing. I mean, one of my hobby is also to review the contracts of other health systems, and I try to get the copy from here and there. Once I remember I read a contract. It was very transparent. It was even written over there, two items. If the hospital makes social media marketing for you, we will deduct the expense from your salary. That was the first article written. The second point, if in case we find out that you break anything in the OR, lens or I mean scope or the other, the cost will be deducted from your salary. Gosh, I mean, I have never expected that. So it's very transparent. And the burnout is a kind of multifactorial issue. So from your surveys and other things, two things I will ask. Please tell us, I mean, what other factors are affecting? Because I don't want people to think that off-call is just about the contract. No, you're also meeting with the doctors, you're identifying the expectations and the other thing. That's one thing I want to hear from you. I mean, what exactly the trend is happening to avoid the burnout? And the second thing, teach us. I mean, are you creating an ideal physician contract and helping health systems? Because I'll tell you another thing. Most of the health systems, I mean, I visit the health systems in Atlanta, in Chicago, in Texas, in LA, and other places. I have friends. I'll tell you one thing. Most of these healthcare leaders, they're not aware of the contracts used in their hospital. Someone else has created ages
Yes.
ago, and it is still with the HR. No one has updated anything, and they're still using it. Are you going to teach the market with kind of a modern physician contract which addresses today's issues?
Yeah, I mean, one of the really exciting things that we've seen at Offcall is we're beginning to do a lot of education that you're talking about, but via virtual webinars and via our podcast and our newsletter. We're doing a lot of virtual education about a lot of these topics, from um, contract issues to tools and how to deploy AI in a way that physicians will be excited about and eager to adopt. And um, we get a lot of attendance on live webinars on a Tuesday night at 5 o'clock from both the C-suite and from frontline physicians, because I think there is, as you said, a yearning for more of this information. And so what I would say to your listeners, anybody who's listening, if you're a leader at a health system, we are trying to we're building this community of physicians. We do have an ear to the ground about what they care about and what the issues are, and we're doing a lot of this education work. So if you'd like to work together and figure out ways to collaborate on things that'd be helpful for your hospital, but also for the workforce more generally, definitely get in touch. I think the second piece is the conversation of the day. We haven't touched on it yet. Is really around AI, and physicians. We recently, at the end of last year, we did a survey of over 1,000 doctors about what they want to see when it comes to AI adoption and what tools they're using. And the same issues that we're talking about when it comes to contract presented themselves directly in this survey. What was fascinating about that survey is that 67 or even more percent of physicians are already using AI on a daily basis. And the vast majority of them, almost 85%, said it makes them better at their job. But 81% and 81%, it's a huge number, are dissatisfied with how their organization is deploying it because they are not giving physicians a seat at the table. And physicians said, most of them said they have no influence in how it's getting deployed. And they have no say in what tools are being used in the hospital or being forced on the physicians. And so you see actually the same exact pattern, which is the lack of transparency, the lack of bringing physicians to the table and having real, meaningful participation in leadership decisions that are going to impact the workforce. You see when it comes to the AI deployment. And the big worry there is this incredible technology, which could actually do a lot of good and eliminate a lot of the more administrative headaches in healthcare, will be deployed in such a way that the EMRs were, 20 years ago, and physician agency will be taken out of the conversation. And therefore, a tool that has a lot of potential will once again leave physicians 5 to 10 years from now asking what went wrong and feeling even more dissatisfied about the profession. So to answer your question at a high level, we think that this transparency approach extends well beyond just salary and contracts. It extends to the other parts of the job. And we're hearing it directly. It's a red alert signal from our audience, from physicians, that they do not have a seat at the table and they're feeling dissatisfied when it comes to something like AI deployment. So any physician leader who's listening has to wake up and understand that putting physicians at the center of these conversations in a real meaningful way and not just a pizza party kind of way is actually a very, very significant and important thing in terms of building the trust that physicians are looking to see from their employer.
I think, Jake, we're going to the very cliche world, but I think here we should also use Offcall is addressing not just the transparency, but the physician engagement. And in so many areas, I think we're losing the game at the physician engagement area. If your physician is not engaged, they don't look after the policy procedures, they don't look after the Medicare things, they don't look after the documentation, the quality, the patient care, and we lose completely not just the, well-being of our physician, the entire organization's well-being will be under risk. So I can see a huge, actually, impact from all your activities from physician engagement. So let's go back to the AI part. Dr. Graham, what do you think? This AI, do you think we will be able to improve this physician engagement and all this kind of issues with the help of AI?
I'm hopeful that we will. I describe myself as a cautious optimist around AI. But to Jake's point, the reason I talk constantly about artificial intelligence and the merging with clinical knowledge and clinical operations is exactly like he said. I think, you know, electronic medical records were not really designed with um, clinicians in mind. And that's broad. That's not just doctors. That's nurses, pharmacists, social workers. They were designed as a documentation tool, a billing tool as well. Those things are changing and improving, but it's been 20 years to recognize that. And so I am hopeful, and I think clinicians are aware that some of our work is like low yield. It's automatable. Um, you have a patient come in with a certain type of chief complaint with a certain list of categories of symptoms. I'm probably going to do the same thing every single time. And that could be something as simple as like,
Indeed.
if the x-ray shows a broken ankle, I'm going to refer that. I'm going to put on a cast and I'm going to give them crutches and I'm going to refer them to podiatry or something like that, right? That's a slightly oversimplified example, but like every doctor knows that some of this stuff is formulaic and algorithmic and could be automated. But the question still remains, like, that I was honestly a little surprised at with our survey is like, well, are they going to listen to the doctors and build the stuff like that the doctors want. Like, do the doctors want an auto referral podiatry tool? I do. I would love that. Like, I would love a system that just does the same thing that I do every single time, does it for me. But are we going to build that and automate it, or are we going to just focus on tools that focus on just increasing billing, or just increasing reimbursement, or just writing notes? All these things have some role, but where do they stand as a priority for helping the physician get through their day, deliver better patient care, not make mistakes, not miss things? And frankly, if they're going to get listened to, I think that will improve engagement. You know, doctors are humans. That's the other thing I try to always convey. We are not robots, for better or worse. Um, and we want to feel listened to and feel like we have some say in how we care for our patients too.
I really love this introduction. And Jake, we need your help. I mean, from the technology point of view, I remember I was involved in the clinic operation in year 2003, where we were having around 20, 25 clinicians, the doctors, and the rehab center later on, almost, I mean, 70, 80 doctors. In my previous system, I was having over 1,000 doctors, and now even more doctors. As a physician leader, I believe in the surveys, but survey is a one-time thing over a year, and then you give a very short period to the people. They're already busy. Hundreds of other emails are in their inbox. Then sometimes they miss you. You have to remind them. Um, I need, as the physician leader, a tool that will help me to stay in contact and in connection with my doctors, and that they can keep sharing their concerns, and then they can reach out to me as the management, and I can address things before it reaches to an explosion level. So then we can have an early detection in our, I mean, dictionary with this way. So I'm sure Offcall can help in this, because you guys are addressing the physician engagement. You're already addressing the transparency on the contracting. I mean, help us as the Offcall in having more connection with our doctors. Then I can hear them and I can keep my, I mean, finger on the pulse.
100%. Just speaking to the survey, if anybody who's a health system leader who is interested in digging in, you can find it right now, and you can read through hundreds of submissions about what tools doctors actually want when it comes to AI and what they don't want. So highly encourage anybody to go check that out. One very interesting thing was, this sounds like a simple thing, but having dedicated funding for AI tools is now a recruitment factor in why physicians choose certain jobs. So in terms of listening to physicians and something actionable, there's a lot of nuggets in there. But I think what you're speaking to, Dr. Fateh, is something deeper, which is about communication and transparent communication and the ability to connect with the workforce and with physicians in a um, in a new way. Dr. Graham is so good at using social media to communicate and to connect and build trust and share his own perspectives. And he's managed to, I think, connect with so many people because the way he's communicating is not the same old way that everybody communicates in healthcare. And from what you just said, you're giving me an idea. There is probably a role for us to fill in helping you as a leader and physicians connect in a deeper way. So if anybody else who's listening is excited about that, also get in touch because it is something that I do think we'd be well positioned to help with.
I actually love your idea for like what's an ideal contract look like as well. Like I was like, oh, we should totally do that. Like that what a great way to just like demonstrate like hey, here's what we think would be great based on what we hear from our physician users. Like hey, these are the things that they all like. These are the things that they all raise concerns about. Um like again, in the spirit of transparency, that would help doctors know what to look for, and that would help employers know, like, hey, if you put this in the contract, your doctor's going to be kind of upset at you, and you're not maybe is not starting out the relationship on the right foot either.
I mean, from my position here and the responsibility, I'm in touch with other industries. banks, large factories, and especially the oil and gas industry. And I was having a meeting last week with one of the oil and gas industry CEO who is managing huge offshore operations. He showed me something. They have an application, and every day morning, especially at these offshore places, they're asking to the employees how do they feel, how they're feeling in the morning, and what actually made their day difficult or the way around. Because offshore part, from mental health point of view, is very critical. I mean, you have to manage things before it reaches to a threshold level. So then, I mean, if we look at such industries and then see that, I mean, such things can be managed, we want to have it in our hospitals, and we want to create a tool which will help us to understand the situation and then act as fast as possible. So
I
I
love
think
that.
we have. Thank you. I think we have covered so many things here. So just to recap quickly, I want to ask actually from both of you, I want to hear something for the healthcare leaders. What do you advise them to create a good environment who could hire the best doctors, retain the doctors, and then have the happy doctors?
I think you can get really far by just showing up and listening. I'll give one example. At my hospital, our hospital and our medical group leaders, hold open town halls to ask questions and to listen and to answer questions. And they also, this is one of the things I absolutely love, they do it on night shifts as well. I think it's like once a month or maybe every other month or something like that. They,
I
they
love it.
recognize that we are a 24/7 operation, and so they'll have a town hall at 11:30 at night. They show up in the hospital, and people can go and ask questions and get questions answered and raise concerns directly to the heads of the organization. What an incredible way to make all
Amazing.
of the healthcare workers feel like they matter. It's not a meeting at 9 a.m. It's at 11:30 so that they recognize care is still being delivered as well. So I think showing up and listening is critically important.
I love it, especially the night shift people. We always forget them, and visiting them is the best thing. Jake, teach us from the technology point of view. What do you advise to the healthcare leaders?
Well, first and foremost, I think if there's one lesson from Offcall for the last year, it's paying the workforce fairly and being transparent, as we've talked about through this whole conversation, is utterly important for any employer and any industry. But in healthcare, things have gone sideways for the last several years, and coming back to grounding the industry and grounding one another in just fair and transparent compensation and workload for physicians will go a long way. And I will say, on the patient side, every patient, when they walk into the hospital, wants a physician, wants a clinician that's well paid, that's excited about their job, that's eager to spend the extra time to give them the diagnosis they want, as opposed to somebody who's distracted or disgruntled. So it's super, super important for both from a patient experience standpoint and from a workplace experience. So that's in first and foremost. And secondly, if anybody who's listening has been inspired, who's a physician, you can come join us at Offcall, join our movement, listen to Graham's podcast each week, be part of the solutions. And if you're a health system leader, Dr. Fateh, you've given us some great ideas today, but we want to build solutions that really help on both sides. And so please, 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 the message here is it's a big open tent. We think technology and building a community of physicians can really help solve the problem. And we're eager to figure out ways to partner and work together. So we're taking a creative approach, and we want to work with the forward-thinking and most innovative health system leaders who are excited about just shaping a better future for the whole industry.
Amazing. I really enjoyed this conversation, gentlemen. Thank you so much for that. And please keep building and keep inspiring. Not just physicians, I believe all the healthcare leaders, even the nursing leaders and others. I recommend them to follow the Offcall and then stay in touch with you guys and listen you and learn from you. Thank you so much.
Thanks so much for having us.
Thank you very much. Dr. Fatih, thank you. We appreciate it.
It's my pleasure. So I would like to close with a reflection. Dr. Graham, in your founder letter, you reminded us that healthcare doesn't suffer from a lack of intelligence or in innovation. It suffers when we forget the inner lives of the people delivering the real care. So that's the same thing in my also book. I intentionally begin with the connection to yourself, because only a connected caregiver can deliver truly connected care to the patients, teams, and communities. Ofcall's philosophy aligns strongly with that belief, and I really appreciate that. And I see this as the direction, the real direction healthcare leadership must move toward. Thank you both for building with intention, with passion, and thank you for joining me today. To our listeners, if you're transforming healthcare, start with one simple question. Are we helping our physicians reconnect with clarity, purpose, and well being? Thank you for listening to the Chief Healthcare Officer podcast show today. And please keep following us. There will be so many other great conversations and guests in the next episodes. Thank you.